Press, Valerie. Thank you. And if she had never been on my payroll, I'm absolutely convinced that none of that would have changed. She would have said it the same way. But coming from a former employee, that means a lot. And I want to thank you for being an important part of our team up in Washington for about a year, I guess. And I wish you and every one of you students the best of luck in the Clinton School. And it's a real honor to be asked to come here today and spend some time with you. Skip, thank you for the invitation. I just came from the funeral of Private First Class Jonathan Christopher Yanni. Jonathan is from Grapevine, Arkansas, and he's just 20 years old. Was just 20 years old, and had been in the Army for 5 months and been in Iraq for 5 weeks. He was the 9th soldier to cross a footbridge, and he was the one that didn't make it. And I hope you'll join me in keeping his family in our hearts and in our prayers. I thought I'd open by sharing with you some of my thoughts. Skip asked me to speak about you'll never guess it, healthcare reform, and also a little bit about the Blue Dog Coalition. So I thought I'd visit with you a little bit about that and then throw it open for any questions anyone might have. But the American experiment was a risky one. Never before had a country been founded on the idea that people rule. And it was a rare concept that historical scholars throughout Europe believed stood no chance. If we failed, the framers faced almost certain death and tyranny would have endured. However, over 230 years later, the United States of America has succeeded beyond expectations, and our nation remains a bold example to budding democracies everywhere. The critical component of our democracy has always been involvement by the people, an involvement that goes beyond casting a vote. Our democracy grows stronger when people research the issues, speak up, and question their elected officials, and organize to make their country stronger and better. What I have seen over the past few weeks has shown me that our democracy continues to thrive like never before. The politics of healthcare reform has brought people from all backgrounds and all ideologies into the political process. More Americans are writing and calling their elected officials. More Americans are attending town hall meetings. More Americans are organizing and mobilizing in favor and against this issue. And more Americans are doing their research. This healthcare debate, to me, is the greatest demonstration of democracy that we have seen in a very long time. I recently hosted a town hall meeting at Henderson State University in Arkadelphia, and used to go to, I've been going to Arkadelphia for 19 years because I was also their state senator before I was their congressman, and if I typically wouldn't have more than 25 people show up for a town hall meeting, and that was if my aunt and uncle were in town. At Henderson, we had about 900 people. And one of the guys in the back of the room was being disruptive, and the other audience members were shouting him down. And my response to them was, if that fellow wants to jump up and down and holler and scream, let him. This is America. And that's how I feel about it. This healthcare reform debate is also nothing new to me. It's been something I've cared passionately about for quite some time. In the state Senate, I served on the Public Health Committee. As a former pharmacy owner and someone that's married to a pharmacist, I've experienced firsthand some of the healthcare challenges many of our customers and friends faced on a daily basis. When I decided to run for Congress back in 2000, I campaigned on healthcare reform. When I came to Congress, I worked to secure a seat on the House Energy and Commerce Committee, whose jurisdiction includes healthcare, and on the Health Subcommittee. I mentioned my background because it is no accident I found myself in the center of this national healthcare debate a few weeks ago. It just turned out more people seemed to care about what I had to say. I am a member of the fiscally conservative Democratic Blue Dog Coalition, and before this health care debate, few people had ever heard of our group. But we had been around for about 15 years. We, as members of the Blue Dog Coalition, have built our reputation based on our commitment to bringing a moderate viewpoint to the Democratic Party in Congress. In fact, since the coalition's inception in 1995, we have consistently promoted positions which bridge the gap between ideological extremes. We pride ourselves on providing a consistent and moderate voice in what is all too often an overly partisan Congress. While the Blue Dog Coalition consists of members from every region of the country, we are united in our unyielding commitment to the financial stability and national security of the United States. Blue Dogs also share the fundamental belief that government should be fiscally responsible and fully accountable to its people. This requires that we make tough decisions, but that is precisely why we are elected to Congress. Members of the Blue Dog Coalition are willing to make the tough and often politically unpopular decisions. We do not prescribe to a far left or far right political philosophy. We're in the middle, which is where I believe most Americans are. The Blue Dog Coalition formed following the massive election losses of 1994 for Democrats. Those elections, as you'll recall, landed the House, the Democrats in the House, back in the minority. The founding members chose the name Blue Dog Coalition because many of you have heard the old adage, yellow dog Democrat, meaning it doesn't matter who's on the ballot, it could be a yellow dog, you're going to vote for the Democrat. Well, we were a group of yellow dog Democrats that feel like we've been choked blue by the extremes of both parties. And over the past 15 years, the Blue Dog Coalition has grown from a small organizing group to a 52-member strong organization within the 111th Congress. The coalition has built a reputation as a serious player in the policy arena, promoting positions which bridge the gap between the ideological extremes. Many of the group's proposals have been praised as fair, responsible, and positive additions to a congressional environment too often marked as partisan. Members of the Blue Dog Coalition are dedicated to the financial stability and national security of the United States and are united behind a core set of beliefs that transcend partisan politics, which include the following. The Blue Dogs represent the center of the House of Representatives. The Blue Dogs appeal to the mainstream values of the American public. The coalition developed substantive proposals and positions distinct from those advocated by the extremes of both parties. Blue Dogs are independent to the leadership of either party. Blue Dogs influence the legislative process by forming a united voting bloc. And by electing Blue Dogs to Congress, the country has sent a strong message to Washington in favor of fiscal responsibility and the bipartisan ideals that the Blue Dogs were founded upon. The election of Blue Dogs signaled a victory for the Blue Dog beliefs that the people trust our representatives to transcend politics to work for the common good, that a government too large and intrusive stands in the way of opportunity, that a government must live within its allotted resources, that government should be a force that affirms traditional American values and stands against the forces that threaten them. Earlier this year, the Blue Dog Coalition created 3 task forces to ensure it had a voice in this new Democratic White House and Democratic Congress. They were on the budget, on energy, and on health care. Because of my background and deep commitment to health care reform, my fellow Blue Dogs chose me to chair the Blue Dog Health Care Task Force. In this role, I directed the efforts of our group to gather expert opinions, to explore various courses of action, and to ensure that any reforms to the system were in the best interest of working families and small businesses and were responsible to the American taxpayer. In February, I was one of the few members of Congress invited by President Obama to the White House's National Summit on Healthcare Reform. Joined by Democrats, Republicans, and independents, alongside representatives from hospitals, health insurance companies, and consumer groups, we all came together united behind the need for healthcare reform, determined to get it done this time. I believe we all left optimistic and energetic. As the debate moved forward, the Blue Dog Coalition asked to be included in the process. In May, I wrote a letter to the House leadership signed by 45 Blue Dogs, asking that they include the moderate wing of their party with a substantial voting bloc on the drafting and outlining of the bill. We want to be able to support the eventual House product, we said in that letter, and we believe that the probability of that occurring will be dramatically increased by a process which allows for our early participation. On July 9th, I wrote another letter to our leadership, signed by 40 Blue Dogs, that said we express our strong reservations about the process and the direction of the draft House Tri-Committee Healthcare Reform proposal, and warn that too short of a review period is unacceptable and only undermines Congress's ability to pass responsible healthcare reform that works for all Americans. Still, we were pushed aside. Our concerns with the proposal were not outrageous. In fact, we outlined each of them in a letter dated July 9th. We thought the proposal was too costly and not deficit neutral. We thought the proposal did not go far enough to protect our vital small businesses. We do not think the proposal did enough to address rural health equity. We did not think cost and inefficiencies were squeezed out of the current system. And we did not think the public option was structured in a fair manner. Around the same time, Doug Elmendorf, the director of the nonpartisan Congressional Budget Office, said the health care reform bill proposed in the House at the time was not deficit neutral and actually added to our debt substantially. His report only underscored what the Blue Dogs and I had been saying all along. However, House leadership pushed the proposal through the legislative process anyway to meet an August 1st deadline of passing a bill on the House floor. The bill passed the House Education and Labor Committee and the House Ways and Means Committee in marathon sessions that went to 3 and 4 in the morning. Then the proposal came to the committee in which I serve on, the House Energy and Commerce Committee, and I, along with 6 other conservative Democrats, had major concerns about the bill before us, enough to stop the legislation. What ensued was 2 weeks of intense, often passionate, negotiations between the 7 of us and Chairman Waxman, Speaker Pelosi, in the White House, along with national media following us at every step of the way. Numerous meetings with the Speaker, the Majority Leader, more than an hour in a room with the President. Our goal was never to kill health care reform. If it was, then we could have simply walked away. We banded together because we felt we were moving way too fast. This is the single biggest domestic overhaul in 50 years, and I strongly believed that we needed to slow down and get it right. Oftentimes, legislation affects one group or another. This legislation will affect all 300 million of us that live in these United States. For those 2 weeks, I demanded concessions from House leadership, and we eventually got them. First and foremost, we got House leadership to delay a full floor vote on the health care bill until September so that members of Congress would have time to actually read the bill and listen to their constituents. We also squeezed inefficiencies out of the health care system and substantially lowered the cost of the health care reform bill by more than $100 billion. The agreement helped make health care reform deficit neutral, meaning it could not add a dime of debt to our government. We also added provisions to protect small businesses by reducing the employer mandate requirements to provide health insurance to their employees while still making sure employees have access to affordable health care. Between 60 and 80% of all the new jobs in America come from small businesses. And in rural districts like mine, it's even much greater than that. Throughout this debate, I thought a lot about Sandy. Sandy owns the Broadway Cafe in my hometown of Prescott, Arkansas, where I oftentimes join my family and my mom and dad for lunch after church on Sunday. Not only is Sandy not able to provide health insurance to her employees. She doesn't have it for herself. And she's trying to hang on 3 more years until she's Medicare eligible for a needed heart valve operation. So it didn't make sense to me that we mandate on our small businesses that they provide something that they'd already like to be providing if they could, and that is health insurance for their employees. But too many of them don't even have it for themselves because they simply don't make a lot of money. That's why we call them small businesses. So it was important for me to see us develop a plan in which not only Sandy's employees, but also Sandy can go and be part of a larger group and be able to afford health insurance. But we did it in a way to where we do not punish those small business employers. We made sure rural hospitals were fairly reimbursed under a public health care option and allowed for the establishment of consumer-driven state-based cooperatives to offer even more choices. Finally, we ensured that the public health insurance option will not be forced on anyone and will negotiate rates directly with providers, forcing it to compete on a level playing field with private insurance companies. Some of the liberal groups got upset with me over what they perceived was us watering down the public option. Nothing could have been further from the truth. The reality is this. You know, I've heard all the rhetoric that we did that for the insurance companies. I've heard that, you know, I've got the support of the healthcare industry. I had no idea whether I'd receive much support from the healthcare industry or not. Thousands of people contribute to our campaigns. But we did the math on it, and 8% of my donations to my campaign committee have come from healthcare. 8%, that's it. But for those of you that think 8% is too much, and if you're not in the healthcare business, you can help me even reduce that percentage even more by going to MikeRoss.com. The reason I was so passionate about this issue was quite simple. Just go to any doctor's office. Go visit 10 doctor's offices in Little Rock or Pine Bluff or Hot Springs, and I promise you at least half of them, if not more, will have a sign in the window that says we no longer accept new Medicare patients. And yet we were going to add tens of millions of new people to a public option based on Medicare rates? What a cruel hoax that would have been. Working families have been waiting their entire life for an opportunity to have affordable health insurance. And we came very close, folks, to providing them a shiny new insurance card that they would have been able to take to doctor office after doctor office across Arkansas and been turned down. It would have been very difficult for them to find a doctor, just as it's very difficult today. Seniors oftentimes wait 3 months when they move to places like Hot Springs before they can find a doctor that will take them on as a patient. In many of our rural hospitals, we lost the rural hospital in my hometown in 1995, and I don't wish that on anyone. Many rural hospitals are barely hanging on today, and if a public option had been based on Medicare rates, I can assure you that it would have driven many of those rural hospitals out of business. So all we're simply saying is, if there's going to be a public option, let's have a level playing field and go out and negotiate rates with the doctors and the hospitals just as the private insurance companies do. Well, while we are making progress, it is important to understand the agreement we reached is a small step in a very complex and lengthy legislative process. There are 5 different health care reform bills in the House. Actually, it's 1 bill in the House, but it was marked up in 3 committees, and so it was subject to amendments from 3 different committees. So it's like 3 bills at this point that must be put back together. And there's 2 bills in the Senate, one of which has not even been written yet, the one in the Senate Finance Committee. And in my opinion, 90% of what the final bill looks like is going to be what comes out of the Senate Finance Committee. I have people tell me they're against President Obama's health care plan. He doesn't have a plan. You know, President Clinton was heavily criticized in 93 and 94 for the perception that that bill was written in the back rooms of the White House. President Obama, in March at the White House Health Care Summit, said, let's let the legislative process work. And that's what we've been doing. And, you know, there's a reason for the saying, 2 things you don't want to see being made are sausage and laws. And there's a reason for that. It's not a pretty process. And then I have other people come up and tell me they're against the bill. Well, again, there's 3 bills in the House, or what amounts to 3 bills in the House. There's 2 in the Senate. And again, 90% of the final bill, in my opinion, will come from the Senate Finance Committee. That bill has not even been written yet. So I don't know how anyone can say they're against health care reform until they know what the bill looks like, unless they're just opposed to health care reform. I'm not. I'm for it. I've said all along that we need health care reform, but we need the kind of health care reform that reflects common sense Arkansas values. I've said we need to slow down and get it right. As we continue the discussion, I want to share with you my core set of health care principles that will guide my final vote. While no final bill is yet to be presented, I can assure you that any bill I support must meet these principles. If it does, then if it does not, then I will oppose the legislation. If you like the health insurance you have today, you should be able to keep it and choose your own doctors. Government-run health care should not be forced on anyone. If government-run health care is ever forced on anyone, then the first group to receive it should be the President and every member of Congress, including myself. No federal funding for illegal immigrants or abortions. No rationing of care for seniors or anyone else. Require insurance companies to cover pre-existing conditions, and they should not be able to raise your premiums when you get sick or cancel your coverage. Affordable health insurance for every American citizen with more choices, not less, and with the peace of mind knowing you will never go without health insurance again, even when you change jobs, get laid off, or get sick. I wanted to slow this health care reform debate down so that each member of Congress would have the opportunity to do what I've done, host 37 town hall meetings on health care reform and read the bill. I recognize that almost every American has had a health insurance nightmare story. It's either happened to you or someone you know. The insurance company won't pay for something you need or makes you jump through hoops to get it. I want to know the frustrations and challenges many of my constituents face on a daily basis in regards to health care. Only by reaching out and hearing these stories will we, as members of Congress, be able to create a meaningful health care solution that builds on what works and fixes what doesn't. Every day, insurance companies deny people care. As health care costs continue to rise, more and more people lose their health insurance coverage. Those that support the status quo oppose every idea on the table and have no reform plan of their own. I am constructively working to pass common sense health care reform that reduces cost, increases access, forces insurance companies to cover pre-existing conditions, and protects patients' choice. And the Blue Dog Coalition wants to be a constructive force in this process. It is my hope that the final bill will offer the kind of common sense reform that I and other moderates can support, the kind that the American people need and deserve. And with that, I'll be glad to take questions.
All right.
Skip.
Thank you, Congressman. Now, let's see. We have, who's got the microphones? Bob has one and Nicholas has one. Nick's got one. Okay. Questions? Raise your hands. Right here.
Hi, my name is Judy Watts. I'm from Austin, Texas. Thank you for coming.
Will we turn you into a Razorback fan yet?
No, Longhorns all the way, sorry. Arkansas is ranked 11th among states with highest percentages of uninsured population. So my question is, as a public servant who represents District 4, how will you serve your constituents, which contains so many uninsured people, when you appear to oppose the public option?
Well, again, about 1 in 5 people in my district are without health insurance today, and no one wants to provide them affordable health care more than I do. I think there's a lot of misunderstanding about the public option. Vic Snyder is, I think, by most of you considered a liberal that know him, and he's saying now that he's got reservations about the public option. There's a lot of people that have concern that it's a foot in the door approach for single-payer government-run health care because it's obviously difficult for the private sector to compete with the public sector. Let me explain how the health insurance plan will work, and maybe that'll help you better understand why the people that are so fixated on a public option, I don't think understand how the system that's being proposed will work. Number one, if you've got insurance today, nothing changes. There will be an exchange, a health insurance exchange. And I'm sure y'all have heard the rumor that members of Congress exempted themselves from it. Have y'all heard that one? Well, we didn't. There's nowhere in the bill will you find that members of Congress exempted themselves from this health care reform. Where people are getting that and twisting that is from this. If you've got health insurance at work today, you don't qualify to enter the health insurance exchange unless you're a small business with less than about 10 employees, and over time it will grow to a small business with 50 or less employees. But if you've got health insurance at the workplace today, you're not eligible to enter the exchange. So I'm not eligible to enter the exchange for the same reason that people that work at Raytheon or Lockheed Martin or General Dynamics in East Camden, Arkansas, I'm ineligible from entering the exchange for the same reason that they're ineligible from entering the exchange. So the exchange is available for the self-employed, the uninsured, and the small businesses. They go into the exchange, they shop around. You'll see Blue Cross, United, Farm Bureau, State Farm, Shelter Shelter. Y'all can help me here. There's probably some others. And they compare. There may or may not be a public option in the exchange. Here's why it really doesn't matter. Number one, we're going to reform the healthcare industry to where they can no longer cancel your policy when you get sick. We're going to require them to cover pre-existing conditions. We don't have to give them competition to reform them. And so I don't buy that argument that we do, number one. Number two, here's why it doesn't matter in the exchange. Once you're in the exchange, everybody in America is going to be required to have health insurance, okay? You know, insurance is about spreading the risk. Well, we're not spreading it very well when it comes to health care because basically people either have it because they get it through work or they've got it because they're either sick or they think they're going to get sick. It'd be like, I've got a wife and two children. One's 17 and one's 20. And my wife had the wreck, not the kids. But our car insurance, it's unbelievable. But can you imagine how much more it would be if the only people required to have it were those who've had a wreck? And so we're gonna require some personal responsibility here because when people go uninsured today, who pays for it? Those of us with insurance and those of us that are taxpayers. In fact, for those of us in this room that are fortunate enough to have health insurance, the first $1,100 you pay this year for health insurance premiums has nothing to do with covering you, your family, or anyone else in that group's plan. It simply is the cost of all of us covering the uninsured. And then those that have catastrophic illnesses end up on Medicaid, which is health insurance for the poor, the disabled, and the elderly, and all of us that pay taxes then pay for them that way. So there's going to be a requirement that you accept personal responsibility and you have insurance. But if we're going to do that for the working poor and the middle class, we're going to have to subsidize them when their employer doesn't. And so that's what happens in the exchange is they pick which plan they want. And my point is this, it doesn't matter if they pick the public option that may or may not exist, or Blue Cross or Farm Bureau or State Farm or Shelter Shelter, it's their choice. Whichever one they pick, here's how it would work. Is the most they will pay out of pocket is between 1.5% of their annual income and 12% of their annual income, not only for insurance, but for co-payments too. It doesn't matter which plan they pick, that is the most they'll pay out of pocket. And so if you're at 400% of poverty or below, you're going to receive a government subsidy to help pay for the cost of your health care if your employer is not providing that. And by the way, a lot of people think that we're just talking about people that make less than they do. 400% of poverty for a family of four is $88,200 a year. So if you're a family of four making $88,200 a year or less, which is just about everybody in my 29 counties, then they're going to qualify for a government subsidy to help pay for the plan that they choose. And again, the most they'll be out of pocket at 133% of poverty, they'll be out, if they're below 133% of poverty, they'll be eligible for Medicaid. At 133%, the most they'll be out of pocket for insurance and co-payments in a year is 1.5%. And at 400%, the most they'd be out of pocket in a year would be 12%. Again, the 1.5% and 12% is of their total annual income. And so that's how it would work. And so I don't understand how a public option makes it more affordable for someone, given that that's how it'd work. They're still going to be the same out of pocket regardless of the plan that they choose, and the subsidy would be the same for them regardless of the plan that they choose. But some of these folks jumping up and down, hollering, screaming about the public option, they don't understand how the proposed legislation would work. Otherwise, they wouldn't be saying the things that they're saying. Yes, ma'am.
Hi, my name is Kim Caldwell. I am the other student in our class from Austin, Texas, the fellow Longhorn. And as someone who grew up, I was that kid with asthma that went to the doctor's office like twice a month to get a new either ear infection medication or dealing with another sinus infection. And this is the first time as a graduate student that I haven't had a mom who was a teacher and could provide for me great health insurance, or an employer, my employer that I worked for previously, fabulous health insurance. So I took that $600 plan that they offer students, and I'm crossing my fingers that nothing serious will happen in the next couple years. So how will this plan, or how will what you support, help prevent people from being as underinsured as this group is largely right now?
Well, I think this is how it would work. If you're self-employed, uninsured, you would be able to enter the exchange, shop around. Anyone that's uninsured. If you're no longer eligible for your parents' plan and they have a plan but you don't, or anybody that's uninsured, self-employed, works for a business, I think 10 or 15 employees or less, and eventually working its way up to 50 or less at a minimum, then you're eligible to enter the exchange. You shop around, you pick what you want, and then the government steps in and would subsidize the cost of your health insurance where the employer normally would. But again, you know, these 45 million people in this country without health insurance, I mean, who are they? I mean, it's not the people that can't work. They qualify for Medicaid, which again is health insurance for the poor, the disabled, and the elderly. It's the people that's trying to do the right thing and stay off welfare, but they're working the jobs with no benefits. Are they're students? Or they're right out of college or graduate school, or out in the private sector working for small businesses that simply, again, not only cannot afford to provide insurance to their employees, oftentimes the small business owner doesn't even have insurance on him or herself. So that's how it would work. There would be you'd be required to have it, but there'd be an exchange to go to, and because it is required, there would be a subsidy to help you afford it.
There's right here. Let's see.
I'd like to thank the Dean for holding this together, and I'd like to thank you, Congressman, for being here. You were talking about poverty and... sorry? Oh, my name is Mahmoud. I'm from New Jersey. You were talking about poverty and health insurance, and it just sparked my brain when I was reading an article in the New York Times that said over 70% of people who are homeless because that they went through a health condition and they did not have health insurance. I'd like to have your thoughts on that, and also what will happen. I mean, I hear you talk about all the benefits that will happen when this bill gets passed, but what will happen if the bill does not get passed?
I do believe that we will get health care reform done this year. I don't think. I think we'll get health care reform done this year, and we'll probably, at the end of the day, the liberals will probably be screaming saying we didn't do enough, and the conservatives will be screaming saying we did too much, which means we'll probably just about get it right, you know. That's what I think will happen. But this is not an easy accomplishment. We've been trying, some say since Harry Truman, others say since Teddy Roosevelt. If it was easy, it would have already been done. And I think we've come closer than we've ever come in history to actually getting it done. I can tell you that there's in terms of people that don't have health insurance today, and this is why I think we will be able to get it done at the end of the day, is there is a bankruptcy in America every 30 seconds. Not because somebody went on a spending spree with a credit card, but simply because someone in their family got sick. I've hosted a number of healthcare roundtables at hospitals, and Pine Bluff and El Dorado and Texarkana and Hot Springs, among other towns. And I had a very successful businessman come up and share his story with me, that he had been with the same insurance company for a very long time. He had had 4 bypasses. He was able to afford his premiums, and he paid them on time, and everything bumped along just fine until that insurance company decided to leave Arkansas. It took him nearly a year to find coverage. He's got a $10,000 deductible. His premium is about $1,000 a month, and it will never cover his heart condition. I mean, there are a lot of real-life examples like that of people who have assumed personal responsibility and are trying to play by the rules and do the right thing. And so there's one horror story after another. And I think people, you know, when this debate started, and I largely blame our House leadership for this. When this debate started, too many people thought this was about covering the uninsured. And that is a very important part of it, but there are 3 parts to this. And it begins with what the President said at the White House Healthcare Summit in March, which he invited me to, as I mentioned in my opening remarks. He made it very clear that day that if healthcare costs continue to grow at twice the rate of inflation, it's unsustainable for our government and it's unsustainable for the American people. And so this debate is also about those who have insurance today, ensuring they'll have it tomorrow. And then finally, the third piece is about health insurance reform, doing the kind of reforms that I mentioned in my opening remarks. Here's why this is actually a fiscal issue. And here's why. A lot of people are opposed to single-payer universal health care, and so am I. But the reality is half the people in America already have national health care. It's called Medicare, Medicaid, Our Kids First, Veterans Health Care, Military Retiree Health Care. And when you combine those with Social Security, that consumes 40 cents out of every tax dollar today. I had people get worked up about earmarks. Everybody's against earmarks except for theirs, for their hometown. That's 1% of the budget. I hear people, you know, get worked up about foreign aid. That's 1% of the budget. This is 40% of the budget. And if healthcare costs continue to grow at twice the rate of inflation, that will reach 100% of all federal revenue by 2040. Now think about that. That means we'll no longer have an Army, or an Air Force, or a Navy, or the Marines, or the Coast Guard, or a Department of Education, or Agriculture. Obviously, as a nation, we cannot afford to let that happen. Same thing's happening to the private sector. In 1993, 61% of small businesses provided insurance to their employees. By last year, it was down to 38%. A recent study indicates 1 out of every 5 of that 38% left is going to cancel coverage in the next 3 to 5 years. Premiums have gone up 129% since the year 2000. And so we're already seeing employers shifting more and more of the cost from the employer to the employee, and it's going to reach a point in the next 10 to 15 years where neither the employer nor the employee can afford health insurance if we don't get these costs under control. And then finally, health insurance reform. Don't let the health insurance industry tell you that they can't afford health insurance reform when the top 10 publicly traded healthcare companies in the last 7 years went from a $2 billion profit to a $13 billion profit. Next question.
All right, we have a question right here. Let's see. Right there.
Hi, my name is Julie Meyer. I'm from Appleton, Wisconsin, and my question actually takes a step away from healthcare reform and switches to health education reform. In preparation for your visit today,
Did it get this hot in August in Wisconsin?
I mean, yesterday was kind of feeling like Wisconsin Day, but a couple weeks ago, not so
Yeah.
much. But in preparation for your visit, I was looking through some statistics about children's health in the state, and the most staggering statistic that I found, or the one that I thought was most, I don't know, crazy actually, was that Arkansas is tied for second place among the most obese and overweight children from the age 10 to 17 in the country. So my question is, what are you doing to keep children and adults out of the doctor's office to make an impact on our healthcare costs?
One of the things that, good question. One of the things that, look, this is a free country and we can't legislate how people live their lives, but we can provide incentives. And one of the things we're talking about doing in healthcare legislation is providing no co-payment for wellness and prevention visits. We're talking about chronic disease management, programs that would provide incentives but would be voluntary. There's a company, 80% of the cost of healthcare is in chronic diseases. And a lot of those end up being chronic diseases because people do get too large. Some of it's genetic. Some people can't help it. I struggle with it all the time. Others can do something about it. Some choose to, and some don't. But for example, the kind of things that we're talking about in terms of chronic disease management, there's a company in South Carolina. They took their diabetics on a voluntary basis. They all stayed on the same health insurance. Half of them went through a chronic disease management program. The other half didn't. And they all started at $11,000 a year per diabetic on the plan. And the chronic disease management wasn't rocket science. It was making sure they take their medicine on time, get their refills on time, make sure they're checking their blood sugar like they're supposed to, which is not any fun. Sticking yourselves once, twice, or 3 times a day. And then, just stuff like a cooking school. Teach them how to cook the way a diabetic should eat and have fun with it. And then exercise programs. The half that went through that, their cost went from $11,000 a year to $7,000 a year, while those that didn't went from $11,000 a year to $16,000 a year. I mean, and so we can do some of these things through providing incentives. We've come a long way. We started some of this back when I was in the state senate. You'll find, I don't believe you can find a soft drink machine with sugar drinks at any of the public schools in Arkansas anymore, I don't think. And I think I think the snack machines are gone too. You have, I think, juice machines now instead of Coke machines, if I'm not mistaken. And so there's a lot of things that have to be done at the state level and should be done at the state level, and they've been doing those. But that's what we're doing in this bill to address it, is by having zero copay for wellness and prevention visits.
That's great. Julianne back there.
My name is Julianne Dunn, and I'd like to say I'm from Little Rock, but mostly I'm from San Diego. My question is a little different point of view as well, not as off as Julie's, but how do we ensure with any of these plans that not only does quality remain the same, but that doctors and hospitals are encouraged to become innovative with diagnostic or preventative or treatment of care?
Well, as I said, one of my principles is no ration care. And, again, my position is we need to build on what works and fix what's broken. Look, we've got the greatest healthcare system in the world. And if I get sick, I can't think of anywhere I'd rather be in the world than the United States of America. Here are the kind of issues, though, that we've got to deal with if we want to have the best healthcare in the world 20 years from now, and if we want to be able to afford to access it in 20 years from now. And that is containing these costs. We spend about twice as much money on health care than any nation in the world, and yet we're ranked 19th in efficiencies. And so we need to squeeze every dime of savings that we can out of the current inefficient health care system. I've been to my doctor before and had a test, and he sends me to a specialist. And the first thing the specialist does is run the same test again. Why didn't the test follow me? So these are kind of some of the things that we need to be looking at: chronic disease management, waiving copays on wellness and prevention visits. There's a lot of things that we can do. We're talking about providing an incentive. Too many people leave a hospital and end up back in the hospital a week later. We're talking about providing incentives to hospitals to study why that's happening and what can be done to prevent it. Some of them are unpreventable, and it's going to always happen. But if we can reduce the number of readmissions based on treating them better before they go home the first time, we can see savings from those type of things. But no ration care. This is not about changing the quality of health care. It's about making it affordable.
Demas?
Hi, my name's Demas Espinol, and I'm from Massachusetts. A great part of this discussion on healthcare reform is focused on a shift towards preventative medicine and primary care. I read a study that came out last year that said that by 2025, in 20 years from now, like you were discussing, there'll be a shortage of 35,000 to 44,000 primary care practitioners. In my home state of Massachusetts, they recently, in 2006, had healthcare reform that also had individual mandates. But what we're finding in the state is that because there's a shortage of primary care physicians, people aren't getting to the doctor to see them. So the preventative medicine goes down the drain. And so do you feel that there's enough discussion on Capitol Hill to increase the primary care workforce? Because without that, any type of health care reform will fail.
Very good question. My hometown, Prescott, Arkansas, 20 years ago we had 6 doctors. Today we have 3, 2 of which are well over retirement age with no prospects of any new doctors locating there. I had a meeting with healthcare professionals, providers in Hot Springs last week. You know what they wanted to tell me? They wanted to tell me how they cannot get general practitioners to locate in Hot Springs, Arkansas. Are all of y'all familiar with Hot Springs? I mean, I think if all of us were to sit down and list our top favorite destinations in Arkansas, or what we believe is a very good quality of living in Arkansas, we'd all put our hometown first, of course. But I think Hot Springs would be on everybody's top 5 list. Now, if you can't get family practitioners to locate to Hot Springs, what does that say about places like Prescott and Louisville and Eudora and Lake Village and Dumas? And so one of the things we do in this bill is, one, we prevent a 21% cut to doctors from occurring January 1 of 2010. We do that, number one. Number two, if a doctor chooses family practice, they're going to get a 5% increase in their Medicare payment. And if they also choose to locate in a medically underserved rural area, they'll get an additional 5% increase in their Medicare patient. And then finally, the Health Corps, which is like the Job Corps, I think it's National Health Corps or whatever, it's something like that. I forget exactly what it's called. But we're also going to increase the number of people that we accept into that program, which provides loan forgiveness and encourages folks to pursue a career in healthcare and to locate in medically underserved areas. But you're absolutely right. General practitioner, you know, I call him the Marcus Welbys. I don't know, you are too young to remember that show, but he's seen the reruns. But Marcus Welby, MD, was a TV show. He was kind of a family doc, you know. The typical family doc in Arkansas today has about 2,500 patients. Within 10 to 15 years, the typical family doc in Arkansas is going to have 10,000 patients, 4 times the patient load they have now, if we don't get more people into family practice. And that's what we're trying to do in this healthcare reform debate.
Other questions? Corey?
Hi, I'm Corey Biggs. I'm from Paragould, Arkansas. Yeah. Thanks for coming, by the way. But I have to say, one of the most frustrating things for me in this debate as a proponent of reform is that other proponents of reform, specifically the White House, have seemed to think that logic would carry the day on this debate, whereas opponents of reform have, not surprisingly, found this to be an emotional issue. You know, there's been a lot of talk from proponents of reform that about debt and efficiency, and just a second earlier you said that you saw this as a fiscal issue. Well, I have to disagree with that. I think healthcare reform, more than anything else, is a moral issue. And it's frustrating to me that we haven't heard from proponents of reform the type of honest argument that can also appeal to people emotionally. You shared with us a story about Sandy, the cafe owner, earlier, but that's really, I think, the only story, personal story, that I've heard from somebody on the proponent's side of the aisle in this entire national debate. So where have those stories been, and where's the disconnect between proponents of reform and the people?
Well, again, I don't think our leadership's done a very good job of explaining what we mean when we say healthcare reform. The majority of the people in America think we're talking about covering the uninsured, and so if you're not uninsured, you kind of tune it out, or you're too often times you're against it. Again, this covering the uninsured is part of it. Health insurance reform is part of it, and ensuring those that have insurance today will have it tomorrow is part of it. All I can tell you is that I'm going out and traveling my half of Arkansas and letting folks know the kind of health care reform that I support. I had a telephone town hall I've done 37 town hall meetings, similar to this, and then I've had, I don't know, 5 telephone town halls. I had one last Thursday night. I think, last Thursday night we had 7,507 people on the phone. And I can tell you, when I tell people, do you support health care reform, if it means this, we won't force government-run health care on anyone. In fact, I think I can read it to you. This is not scientific, but it's 7,507 people last Thursday night. I'll just share all these with you because I think it's worth you hearing. Are you concerned that if you lose your job today, you will have trouble getting or affording health insurance tomorrow? 64% said yes, 35% said no. Do you believe Congress should pass tort reform at the federal level, or do you believe it should continue to be legislated by each of the 50 states? This one kind of surprised me. At the federal level, 36%. Let the states handle it, 64%. Do you support legislation to stop health insurance companies from denying coverage for pre-existing conditions? 76% said yes. 24%, for some reasons, said no. But and this is what I mean when I don't think this debate and the notion of health care reform has been framed the right way. Here's how I frame it. Would you support health care reform if the following principles are included? Keep your current insurance, choose your own doctor, no government-run health care forced on anyone, and if it is, the first group to get it should be the President and members of Congress, no federal funding for abortions or illegal immigrants, no rationing of care for seniors or anyone else, and all insurance companies will be required to cover pre-existing conditions. Now, when you frame it that way, 83% say yes, I'm for that kind of health care reform, 17% say no. And that's what I've been out here trying to do and talking about real-life examples of people that, like I said earlier, there's a bankruptcy every 30 seconds simply because somebody got sick, and about half of them actually had some type of insurance. Too many of them are what we call the underinsured. But I'm with you. I mean, no one gets more passionate about this than I do. No one wants to see health care reform happen any more than I do. We've got to go out and sell the right kind of common sense health care reform to the American people and to the people of Arkansas, and that's what I've spent the month doing. But you're right, it's very frustrating because there's so much misinformation. It's estimated $57 million has been spent by special interest in the last 6 months, most of it in the last 45 days, trying to scare folks with radio and TV and direct. I saw an ad the other night on TV. It scared the living daylights out of me. And I finally got one of those DVR things, got tired of hearing everybody else talk about them, and my daughter taught me how to use it. And so I saw this ad, I went back and rewound it and watched it. It used the word could 6 times. Could do this, could do that. I mean, they're designed to incite fear and anger in people. But I think people are starting to see through that now, and I think people are beginning to understand what this health care reform debate is all about, but it hasn't been easy. I've spent the entire month traveling Arkansas, looking people in the eyes and promising them I will never vote to kill old people. Now, if I'd done that a year ago, you would have thought I'd lost my mind. I mean, that's how insane this entire health care debate has been, and how it's so, there's so much misinformation out there. Jeff?
Hi, my name's Adam Moreland. I'm from Morgantown, West Virginia. My question is regarding malpractice insurance. I read a study recently that said that there is a huge increase in the past few years in the number of tests that doctors are ordering for their patients, many of them unnecessary, simply because they are so afraid of getting sued for medical malpractice. The costs of malpractice insurance have been rising exponentially, and I was wondering if the healthcare reform has addressed that factor at all.
At this time, tort reform is not included in any of the health care bills. Now, having said that, let me tell you this. The Republicans, that's kind of always been a Republican issue. In my opinion, the Republicans are too closely tied to the drug manufacturers and the health insurance industry, and Democrats oftentimes get tagged as being closely tied to trial lawyers and unions and those and those type groups. But here's the reality. The Republicans control the White House, the House, and Senate for 6 years. And for 6 years, they didn't pass tort reform. And the reason is this, and I mentioned it a little bit earlier, but tort reform right now is for the most part a states' rights issue. Legislation in the 50 states regulates tort reform. And a lot of states in recent years, Georgia and Texas, Arkansas to some degree, has passed significant tort reforms. And so the debate becomes, do you really want, you know, the funny thing is most of the people asking me about tort reform are the ones that are typically telling me we got too much federal government in our lives, and yet they're telling us that they want us to override the laws in 50 states and make it a federal issue. There's a lot of people that believe we need tort reform. I think we need tort reform, but we need common sense tort reform. I mean, there's bad actors in every profession. I know it's going to shock you, but we have a few in Congress. And there's certainly bad actors in the medical profession too. And you know, if a doctor shows up drunk, supposed to cut off your right leg and cuts off your left leg, and then you still got to have your right leg removed because that was the malignant one, and then you have no legs, I think there should be some recourse there. And so it's got to be done in a common sense kind of way, but most people believe that we should not override the laws in 50 states. What people really believe is that the laws in those 50 states and some of those states need to be beefed up. But I mean, I'm willing to consider it. Look, healthcare costs are growing at twice the rate of inflation. As far as I'm concerned, there's no sacred cows here. Every issue that drives cost has got to be on the table. The drug manufacturers, the trial lawyers, the health insurance industries, doctors, hospitals, every contributing factor needs to be on the table for discussion if we're really going to squeeze the inefficiencies out of a very inefficient healthcare system.
Congressman, let me ask you a question.
Yes, sir.
You just said that you thought 90% of the new bill or the final bill would be written by the Senate Finance Committee. Given the recent death of Senator Ted Kennedy, the emotion associated with that, the possibility now, growing possibility or emerging possibility that Vicki Kennedy will take that interim appointment with lobbying from her fellow friends and his former co-workers. What impact is Kennedy's death going to have on the Finance Committee? And do you see this at least coming out of the Senate as a salute to him, as a final salute?
I think there will be those in the Senate and in this country that, if health care reform passes, will see it as a way of paying tribute to him and his lifelong work of trying to make health care affordable for everyone in this country. So I certainly believe it will be portrayed that way, and it might very well be the reason that we end up getting a compromise through the Senate. Look, I think what's going to pass the Senate is probably not going to include a public option, which is going to upset the more liberal members of the House, again, because I don't think they clearly understand how it works. You're still going to pay between 1.5% and 12% of your income for premiums and co-payments, regardless of which plan you pick within the exchange. And again, the only way to get in the exchange is currently be self-employed or uninsured. For those of us that have insurance, nothing really changes. But I think it will. I think Senator Kennedy's passing might very well help the Senate in its need to craft a bipartisan health care reform bill. I wish we could pass a bipartisan bill in the House. We can't. The Republican leadership in the House has made a conscious decision that they're just going to be no on everything, hope the economy does not improve, and then they'll pick up seats in the midterm elections. And so their members are not even allowed to try to work with us on a bipartisan solution. And look, this is not a Democrat or Republican issue. This is an issue that confronts all of us in America, and we had a bipartisan vote on Social Security and Medicare, and I believe we need a bipartisan vote on health care reform. And people that point to government as not working, remind them of this. Our government has its shortfalls, but I can't think of a better government anywhere in the world. Let's think about Medicare a minute. 40 years ago, we didn't have Medicare. What happened? You got old, the insurance company canceled your coverage, and you had ration care. You rationed it yourself, and as long as you had money in your checking account, you got care. And when you ran out of money, you died, and you died in poverty. That's what America looked like just 40 years ago. And now we've got, Social Security's kept over half the people in America out of poverty. Medicare has significantly contributed to that. And now we have a system where there's no ration care, and when you grow old, you know that you'll have health insurance that's affordable. We've got our challenges and problems with Medicare and Social Security. But think how far we've come and what we've accomplished. And there's no reason why, if we all work together in a bipartisan way, like we did with Social Security and Medicare, that we can't pass the kind of health care reform that builds on what works and fixes what's broken.
Got time for one more question. One more question. You've had your hand up here for a long time.
Thank you. My name is Lindsay Johnson. I'm from Memphis, Tennessee. And I guess I kind of wanted to follow up with Adam's question about the tort reform. I know that the Congressional Budget Office has come up with over 100 different things we can do to reduce costs. But I'm wondering what, in your opinion, are the 3 most important policies or mechanisms that we can do to reduce costs in the healthcare system?
Very good question. I think number 1, chronic disease management, which I've already touched on. Number 2, eliminating co-payments for wellness and prevention visits, I think is an important part of what we need to do. And then another thing that's very important that has been misrepresented and is difficult to talk about is living wills. And let me tell you what I mean by that. What we're talking about is when you get health insurance, you'd be presented a living will document that you can complete. And it's not, and they're pretty complex. I mean, do you want to, if you're terminal on your deathbed, do you want to be shocked back to life? Do you want a feeding tube? Do you want a respirator? How do you want your pain managed? And when that's presented to you, you have 2 choices. You can complete it, and someday it'll end up in your medical information technology record, or you can throw it in the trash can. That's what this entire debate is about. The death squads, isn't that what Sarah Palin called them, or whatever it was? I mean, how unbelievable is that? I mean, we're talking about a form when you get insurance that you can either complete or you can throw in the trash. Every 4 years, your driver's license in Arkansas comes up for renewal. That just happened to me. I just turned 48. Went to the revenue office, walked up there, came my turn. It's not a long wait in Prescott, Arkansas, by the way. And they said, do you want to be an organ donor? And I said, absolutely. But if I'd said no, I would have still got my driver's license. That's all we're talking about here. And here's why it's important, is too many times today a patient's wishes are not being observed. I happen to know a family that recently went through this. The mom was in her late 90s. She was terminal. They rushed her to the hospital by ambulance, and before the family even knew it, they had her on a respirator. And then the son flies in from out of state, and the daughter's there that actually lived with her mom, and she knew mom had a living will, and the brother didn't, and he didn't want to let go of mama because he lived out of state and hadn't seen her as much as the daughter that lived with her had. So they get into a fight. And it lasts for 5 days until finally, after 5 days, the daughter finds mama's living will in a shoebox under her bed. Well, number 1, mama's wishes, and then mama's wishes were respected. But for 5 days, mama's wishes were not respected, number 1. Number 2, that incident cost Medicare about $50,000. And I talked to other doctors about this, and every hospital I've been to, the doctor will say that they've got anywhere from 3 to a dozen patients right now. They said the only difference is it's not a brother and a sister fighting over what mom would prefer. They said it's usually about 25 family members. And it's horrible for the family to have to make those decisions, number 1. Oftentimes it splits up a family. And we went through something similar to this with my grandmother back in 2003. She was 93. And believe me, what's wrong with a person indicating what their wishes are and having it there for the medical professional to have in your time of need? That's all we're talking about. But those are the three things that can, and then waste, fraud, and abuse. For every dollar and I know that sounds corny, but the reality is for every dollar that we invest in waste, fraud, and abuse, it saves our government about $1.75. Now, I don't know many business people that wouldn't like to get that kind of return on their money. So I think those are probably the four things that we can do the most. And then finally, everybody having insurance makes it cheaper for everyone. Again, the first $1,100 we all pay this year is going to cover the uninsured. And if everyone has insurance, insurance is about spreading the risk, and that's why we can maybe not bring down the cost, but get healthcare costs to where they stop growing at twice the rate of inflation, or 129% in 8 years.